Hello, I'm Dr. Ki-up Kim, Korean facelift surgeon, extended deep plane, at Lip Plastic Surgery in Seoul.
What makes the deep plane facelift different from existing facelift techniques?
The deep plane facelift differs from traditional techniques in that it does not just tighten the skin or adjust the superficial smooth layer. Instead, it releases key retaining ligaments, such as zygomatic and masseteric ligaments, and repositions the deeper facial structures as a single unit. This allows for true anatomical repositioning of the mid-face, jaw, and neck, rather than simply pulling the skin. As a result, the outcome looks more natural and lasts longer, because it restores structure, not just surface tension.
What are the key structural differences between Caucasians and East Asian faces?
Caucasian faces typically have more forward projection, especially in the cheekbones, with a narrow jawline and more defined contours. East Asian faces tend to be wider and flatter in the mid-face, with less anterior projection and more laterally positioned cheek prominence. These character differences determine where soft tissue sits and how it shifts with aging, which directly impacts how a deep plane facelift should reposition that tissue.
If the deep plane facelift works at a deeper anatomical level, how does that change depending on ethnicity?
That's exactly where things become more prominent. Because the deep plane facelift operates on structural anatomy and differences in bone structure, soft tissue distribution, and ligament behavior between ethnic groups directly affect how the surgery should be performed. In other words, the technique itself isn't one size fits all. It must adapt to the patient's underlying anatomy. This is especially important when comparing Caucasian and East Asian facial structures, which differ in fundamental ways.
How do these structural differences translate into different aging patterns?
Because Caucasian patients generally have thinner skin and less subcutaneous fat, aging tends to present as volume loss, skin laxity, and more visible wrinkles. In contrast, East Asian patients often have thicker skin and more soft tissue volume. Instead of hollowing, they tend to experience heaviness and downward displacement, especially in the mid-face. So, while one group loses volume, the other often deals more with descended volume.